I'm really pleased to be with you all this afternoon and talk about some of our ongoing research here at the school. Just quickly about me, I have been at the Mandel School for 21 years. I am an associate professor. I direct our master's degree in nonprofit management, and I also co-direct the Center on Urban Poverty and Community Development, the home where most of this work is taking place. So I'm just delighted to be with you all. Thank you for coming in person. Thank you for streaming. I'm a little sheepish because I know that the first Impact Talk speaker was my wonderful colleague, Dr. Adrienne Fletcher, and she blew the roof off. So big shoes to come in after, but I'll do my best. So I'm talking today a little bit about how data can play a really vital role in social justice work. And I'm using as our example the ongoing lead prevention work in the city of Cleveland. So I want to walk us through. I want to review with you a little bit of the what research has been going on, and particularly how it relates to the really groundbreaking coalition work that has been underway since last year. And then talk about the school's role in ongoing evaluation and monitoring of what is essentially a public policy. So I want to pull back and start with a graph that gives us a little data on lead exposure in children. Now you might come to this talk and say, lead exposure in children, isn't this something we solved long ago? And unfortunately, this public issue, many people have had that understanding. And we could attribute that to wishful thinking. We can attribute it to a belief that it doesn't impact our children, it's somebody else's children. We can just attribute it to a graph like this that shows tremendous progress over time. And these are data from the city of Cleveland and Cuyahoga County. What I'm showing you here are in the dashed lines. Those are the exposure rates of children, elevated blood lead levels of children using a standard of 10 micrograms per deciliter, which up until 2012 was the national standard for concern. And in 2012, that standard was lowered from 10 to 5 micrograms per deciliter. What does that mean? It means we learned so much about the risk from lead to children that nationally we lowered the standard in recognition of the harmful effects on children. And so those solid lines, the two upper lines there, show you the trend at that lower level of 5 micrograms per deciliter. And then footnote, in October, CDC at the national level lowered the standard yet again to 3.5 milligrams per deciliter. None of my graphs are going to reflect that. So these are analyses that we have yet to undertake, but at the national level, it basically means a tripling of the number of children in the US that have been lead poisoned according to that standard by going from 5 to now the lower 3.5 micrograms. So these are recent times, and you can see that progress. And in the most recent data, about 10% of the children in the city of Cleveland tested in a year are testing above that standard of 5 micrograms. And it's come down substantially. And I think that's great news, and that is a national story. But the reality is still about 1,200 children in 2019 tested above the standard in the city of Cleveland. Children whose lives, for the most part, will be irrevocably changed due to that exposure. Most often that happened in their own residence, unwittingly to their parents. I'm going to keep looking back there and hope, thank you. So obviously not every child has the same risk of being lead poisoned. I'm showing you here a graph of Cuyahoga County for last year. And what I would say about 2020 is it's a troubling year because testing is the way we know how many children have lead in their bloodstream. Last year, testing rates were down by about 33% in the city of Cleveland. COVID had that effect on all systems, and so we had less surveillance of this issue. But I say that partly in recognition that our long-standing national policy on determining whether lead was a problem was essentially to send children into those environments as canaries, to test whether there was a risk. That was our primary indicator of whether we should do something. A child got poisoned, so we must react. And in the most recent decade or more, there has been much more emphasis on moving upstream prevention, because that's an unacceptable way to inform public policy. So if you just look at this map, the city of Cleveland marked in the red line there, you can see the yellow areas which are showing higher rates, 12 to 20% of children testing above the standard in 2020. I want you to remember that pattern because it's dominantly east side of the city of Cleveland and then on the near west side, because we're going to look at some other maps in just a second that are going to tell us something important. I also want to note that while Cleveland is in a way ground zero for lead poisoning in Ohio, it is where it's happening. In our county, we have about 14% of the tested children in the state, but we account for about 40% of the children who are poisoned. So this is where the risk is greatest. But if you took all our suburbs, think of our inner ring suburbs like Lakewood and Cleveland Heights and others, and pretended like they were their own county, they would actually be just behind Lucas and Hamilton counties, the two other major metro counties that we think about. So our suburbs are not without considerable risk to children, primarily due to the age of the housing stock. So here's that map I was telling you about. If you look on the right there, those are blooms that show you where children have tested positive over a several-year period. But if we go back in time and we start with our red line map from Cleveland in the late 30s, neighborhoods that were marked as places you didn't want to invest, and then come forward to, and I could have in here a whole variety of different graphics, and they're all going to have a similar pattern. This one shows you toxic home purchase loans that were done in the lead up to the housing crisis of 2008. We have had a long-standing history of disinvestment in these neighborhoods that the bill is coming due, and it disproportionately affects the families that we are most concerned about, the poor, renters, and dominantly children of color. So how do we step into this as a School of Applied Social Sciences? Well, one of the pre-questions that we had that was submitted was about, how do you impact the policy process? Well, one thing is you can respond to policy questions. You can listen and provide the data in response to those questions. Another way to do that is to change the question. Help the decision maker get to a better question and then inform them about that. So that's what we've been trying to do over the last decade or so. And really the biggest breakthrough that we had was in 2010 when we successfully, for the first time, signed a data agreement directly with the Ohio Department of Health to receive individual child testing records with identifiers so that we could better understand which children in our community were impacted, and not just at a point in time, but over their life. And importantly, not just where they lived, but what other systems were they touched by, what were the conditions of their neighborhood that they lived in, all those things that, if you think about the ecology of childhood, all those things that are interacting in that young child's life. So we began by doing kind of focus studies, looking at which children were more exposed and what were kind of the initial outcomes that we saw. We also did a major study for the MacArthur Foundation, looking at the relationship between housing quality and kindergarten readiness, and how lead exposure is a really key intervening factor in that relationship. I'll share with you some brief results from a study of Cleveland kindergartners that we did that was received a lot of aha moments among different policymakers. And then I want to focus on what we've been doing over the last 2 or 3 years and share that work with you. So one of the things we have to embrace is, if testing is key to understanding lead exposure, which children need to be tested, right? So the only place we actually have a policy related to that question is for children on Medicaid. So we wanted to see whether Medicaid children were tested according to Medicaid's own rule. So looking at about 18,000 children in our community, we looked to see whether they are on Medicaid after birth. We followed them forward, looked at their testing records. So what you can see is, following those children, about 90% of them were in fact tested at least once before they went to kindergarten. So these are all children that should have been tested at least twice. About half of them were tested around age 1, a third of them were tested around age 2, and in fact only about just under a quarter, or 1 in 5, was tested consistent with Medicaid guidelines at ages 1 and 2. And at the same time, the risk was quite high among these children. 34% had documented poisoning by age 2. So here's a place where we had a policy, we're not living up to it. What's the strategy to improve that? And this led to discussions with our managed care organizations about, how does this happen, directly with physicians about how they order these tests. And it's all the things that we know a lot about, that just because a test is ordered doesn't mean it gets completed, particularly you have to go to another location to have it done. Families move, there's a lack of follow-up, all those things intercede here. But clearly we can do better. But this only covers Medicaid children, right? And in our community, we have a lot of other children who live in this same kind of substandard housing that are at risk. So we have to have a bigger view. So we stepped into this in a second way by looking specifically at Cleveland kindergartners. You remember that early graph I showed you showed that dramatic decline from about 40% testing above the standard to about 10%. Keep in mind that those are annual data, kids tested in a year, what percent tested above the standard. So here's a place where we influenced the question. We said, well, isn't it more important to know whether a child ever got lead poisoned by a certain age? And so with this, we said, let's ask the question, by kindergarten, how many kids have actually had a poisoning event in their record? And so looking at Cleveland kindergartners across 3 academic years, 26% had a poisoning event prior to kindergarten. We are saying nothing about their school here. They didn't get poisoned at school. This all happened prior. They showed up at kindergarten. And in 15 specific schools, more than a third of the kindergartners had a lead poisoning history. So we partly wanted to raise concern about this life course view of lead poisoning. And if you accept that it's a brain injury, so it matters not whether it happened in a particular year, but whether it ever happened to you. And then think about it for a school district that has to respond to the children that come for education. If a third of your kindergarten class, and you're that kindergarten teacher, or you're that social support person, or the social worker, and how that affects the job you can do and the hurdles that you have to overcome as a system of response, it played quite critically. The graph there simply shows that schools reflect the risk in their neighborhoods for the most part, except in places where we have commuter schools. So you can see a couple of white dots towards downtown that are schools that are more like a magnet where children come in from other neighborhoods. So in those cases, we see a lower incidence of kindergartners there because they live farther out and are commuting in. But for the most part, these children reflect the catchment area of the school in which they enroll. So coming forward to today, so we've been studying early childhood work in Cuyahoga County since the late 90s, things like home visiting services, high quality preschool, Medicaid outreach, those sorts of things. And lead was always part of that discussion. but the data we had was essentially from the Board of Health, those annual statistics. We had precious little information about whether particular cohorts of children or even individual children had a lead history. So we wanted to inform that, taking advantage of new data, and we framed, working primarily with Mount Sinai Foundation, George Gund Foundation, and St. Luke's Foundation, a set of studies that would increase knowledge with the expectation that it would inform the community and allow possible a new major initiative to combat lead in Cleveland. So those three studies, one was looking at the effects on children over time as they aged. What could we know about the negative consequences of early lead exposure? The second flipped it and said, okay, who owns these settings where the lead exposure occurs? So actually getting in the weeds of who owns the properties, who are these landlords, how many properties do they own, and what are their conditions? And then the third one was looking outward at cities like Rochester, New York, and Providence, Rhode Island, and Detroit, and others that have undertaken, to varying degrees of success, similar community-based initiatives around lead. So you might say, well, Dr. Fischer, why do we have to do this study? Don't we already know from national data that lead has deleterious effects over time for people? Yes, we do. But if you've been in Cleveland very long, you know that in Cleveland, it matters what happens in Cleveland. So our plan here was to document for Cleveland children that these consequences were severe and long-lasting. So we framed that by using our integrated data system that we hold at the Poverty Center, which has data flowing from about 35 community partners, where we link those records together at the individual person level. And we examined 2 cohorts of Cleveland 9th graders and then linked backwards to see whether they had a lead event in early childhood using our records from ODH, and then following them forward to see whether they were, to what extent they were experiencing things like court involvement, homeless system use, how well were they completing their educational journey, these sorts of things. And we did that by matching children who were lead exposed above the standard to children who were also lead tested but were below the standard, matching on about 14 other characteristics of the children. So getting as best we can a match children with similar kinds of risks but yet still below the standard. So what I want to say about this is we looked at a lot of downstream outcomes in the education space about passing at 3rd grade, at 8th grade, graduating on time, whether they had delinquency filing as a youth or whether they were incarcerated as a young adult, and then whether they were using other systems in the community as a young adult, homelessness, emergency shelter, TANF, food assistance. So what I would say is all of these are, as we expect, they're in the right direction. Kids that had that documented lead poisoning event in early childhood fare worse on every one of these indicators. The magnitude is substantial, 20 to 30% difference in either avoidance of a bad event or attainment of a successful outcome. And if you think a bit from the systems perspective, the effect on these systems is dramatic. The social costs of having this be so prevalent in our community is dramatic. So we're kind of kidding ourselves if we think we're saving money by not addressing this preventatively. We will pay in every other way, and that's over and above the immediate cost to these young children and their families, which, you know, as a matter of social justice, we should say, okay, the cost, great. That's great that we're going to save money, but it should start and stop around that protection of innocent children. Okay, so now I got you all amped up that you probably are really mad at the people that own these properties, right? I want us to walk cautiously here, because the people that own rental properties in our community, many of them are residents of our community, They're low income themselves. They're trying to provide a decent, affordable place to live for other families. So many of them are good actors, and we shouldn't villainize them around this specific issue. There are bad actors, of course, and we can all look at the press and see information about that. But we wanted to really get a sense globally of what the rental properties look like in Cleveland. So I'm not going to bore you with all the details, but we looked at the property level, the parcel. We got information about what was there, and we identified kind of two categories of rentals. Ones that are definitely rentals because they're registered rentals. They registered with the city of Cleveland. They say, I'm a rental, and here I am. And then there's another group that's substantial that are what we might think of as shadow inventory, where they seem to be operating as a rental, but they're not registered. And by some accounts, maybe 30% of the rental properties that are acting as rentals are actually on the registry. So this is a place where the data aren't great. But by going back to the original records, we were able to learn some things about that rental universe. And the goal here was partly to inform this emerging initiative about, okay, how many properties are going to need to be brought up to a lead-safe standard? How much is that going to cost? How much money do we need to raise? How many different owners are we going to have to motivate to do something different in the property they own? So after we completed that work, what we found was, and keep in mind the ordinance that we have in Cleveland only applies to properties built before 1978, because that's when lead paint was outlawed by the federal government. So for pre-78 housing, we found that there are just over 100,000 units, think of them as apartments, in about 55,000 properties or buildings, owned by about 37,000 owners. And these could be owners, as you see on the right, about 3/4 of those are people. So when we look at the ownership record, we can see a person's name, and then about 1/4 are owned by corporations, LLCs, a whole litany of interesting names that you'll find there. And some of them are undoubtedly designed to mask ownership. So in that big universe, only about 30% of that universe of properties actually shows up on the rental registry. So for actually carrying out a public policy, now we're pointing to a problem that the city building and housing department has, is they don't have eyes on people that aren't registered. The only way they can find out that a property is actually a rental and it's not on the registry is if somebody reports them. So it takes a motivated citizen. And if you live in that property, you're probably a little hesitant to report your owner as not being a registered rental. And then I encourage you to look at the full report, but just over half of these properties were single family properties, meaning they were owned by someone and rented to a single family. And then the other 40% of these properties are two-family, double buildings. Half of those were units, a double where both units were rented, and then the remainder, the owner lives on one side and rents out the other side. So it's important to think about what is the relationship of the owner to this property? How close are they to it in regard to their motivation to make it better for a tenant? And obviously there's a lot of attention to corporate owners, particularly those that are located out of county, out of state, who often have they have to have a local operator who manages the property, but they're even more distant from the reality of what's happening on the ground. So the levers that we might use to motivate different kinds of owners are so it's the full gamut, all the way from friendly neighbor kind of information to prosecution. So now bringing us up to the work of the Lead Safe Cleveland Coalition, this group that came together, led really by the Mount Sinai Healthcare Foundation, They were trying to find an issue where funders could make a difference. And lead quickly rose to the top of this as something that had proven to be a durable and concerning social issue in our community. And why hadn't we done better on this? Well, one of the reasons is it's the city trying to interact with a market relationship between owners and renters, which are really at the street level. And then there's the huge cost associated with full remediation of lead, which is one strategy. The Lead Safe Cleveland Coalition landed on achieving a lead safe standard, which means that lead is still there, but it's encased, it's safe, and we know that by dust wipe testing done every 2 years. So you get certified initially, and every 2 years, a tester comes in, an inspector, who recertifies that the lead is still a non-threat. This slide originally said there was a $100 million goal and we're halfway there, but as of January, they fully reached their $100 million goal with commitments from Cleveland Clinic and the City of Cleveland from ARPA funds. So in one sense, money should not be the problem now. We have a coffer to pay and assist property owners to get up to the standard. That's dominantly, it's loans and grants to owners to help them have their property comply. So the ordinance itself, which was approved in the middle of 2019, appointed a lead safe auditor, and I guess our reward for having been so invested in this was the Center on Urban Poverty at the Mandel School was named the lead safe auditor. So that we are a formal external entity that is evaluating the city's performance on implementing this ordinance. And it also created a lead safe advisory board, which it has different perspectives on it, but is providing the city feedback about how to improve the process. And so big picture, we're about 1 year into this 2-year implementation. So by a year from now, all properties in Cleveland should have achieved a lead safe certification, all rental properties pre-78. We're not on path to meet that standard. So the city chose to roll this. They didn't say, hey, everybody has to comply by this date. They selected groups of zip codes here that had different dates of compliance. So we have this rolling requirement. Each quarter, a new group of zip codes was subject. So the red ones, one on the far west, and then on the east side, were the first two zip codes to be subject to the ordinance. And so partly each of these zip code groupings has about 12,000 units in it. So it was building and housing trying to smooth out the workflow demand of all these property owners coming forward seeking to comply. So as I say, we're now, tomorrow we have a group that's in zone 5 that are due to be compliant. So what are we doing as the external auditor? We're trying to use the considerable data that we've amassed over time to inform not just questions about how many properties have gotten certified. That's certainly important. And as of the last quarter, about 2,000 properties had gotten a lead safe certificate. So we'll get new data shortly to update those numbers. But it's also to just understand how we might be changing the rental market. Because if you're a property owner and you don't like this lead safe requirement, you could sell your property. You could stop renting. You could leave the affordable rental space, right? So we want to monitor whether that population or universe of rental properties is actually changing. That's why we're calling this kind of testing, measuring the landscape. And so there's some measures that we're tracking over time related to properties and who owns them, but we're also looking specifically at the children and whether we're seeing any change in both testing rates and elevated lead levels in children. And then we hope that we will not see some effects that have been seen elsewhere about problems, displacement of renters, increased mobility of families as some of these properties might leave the rental space, more evictions. Of course, we've had long-standing moratoria in effect, so we now have kind of a balloon effect that's potentially going to impact this. Although I'll say the Cleveland Housing Court adopted a rule that said if you're an owner and you want to file an eviction, you must be on the rental registry and you must have a lead-safe certificate. So they've used their power there to enforce the, so if eviction is a reward, the process is something that an owner wants to pursue, he's going to have to get compliant on his property before he can advance. And I'll say that's under litigation. There has been a case filed by owners that is an overstep of the housing court's authority. So we'll see how that plays out. I got one more here. Oh, so the lead-safe auditor role that we've undertaken at the center is really focused on properties, owners, and tenants, and monitoring those effects. And then I haven't mentioned the rest of the work. So that's all within what the city does. The coalition itself has funded some very large community-facing strategies. The creation of this lead-safe home fund, which makes available loans and grants to property owners to achieve lead safety. It's created a lead-safe resource center. CHN Housing Partners operates the home fund. Environmental Health Watch operates the lead-safe resource center. So these are two major initiatives trying to educate the community and provide resources to support owners in the process of getting certified and support tenants who may be in the situation where they know they've got a lead risk, they can't afford to move, the property isn't even registered as a rental, and helping them navigate a better solution for them if they have an immediate threat to their child. And then the other part that has been a concern from the beginning is making sure we had enough trained workers who could do lead inspections and remediation in these properties according to federal standards. And so Environmental Health Watch has led an effort to certify more people to be inspectors so that we can get out there and really bring the whole universe of properties into compliance. So I'd encourage you to, if you haven't, take a look at the Lead Safe Cleveland Coalition's website. You can learn more. You can attend community meetings that they hold. You can find all our research on the Poverty Center website. We also have a Lead Safe Auditor page that has reports that we've created as the auditor. I want to just say as a closing comment that since I've been following this issue for a couple decades now, it really seems like we're positioned now to make a major positive effect on this in a lasting way in Cleveland. All the right people, the right organizations, the funders have lined up. And importantly, it's not just whether the city does their job, because the city can only do certain things. It's about whether these community partners are working with the city in a collaborative way to really eradicate this risk to children in our community. So, more to come. I look forward to coming back and giving you another dose, but I'm going to stop there. And thank you all so much for your attention.